Let's get personal for a moment. We're about to enter a brand new year. Let me ask you something. Did you make a New Year's resolution to kick off 2015? How did you do? Do you have plans to make a New Year's resolution to bring in 2016? Maybe you should stay tuned to Health Watch. Hi, I'm Terrence Affer Anderson, and this is Health Watch. Frequently, let's say sometime maybe around late February or March, some New Year's resolutions are known to simply fly out the window or are managed to be conveniently forgotten. Sometimes that happens even earlier. You know yourself better than anyone. Are your New Year's resolutions unrealistic? Maybe you shouldn't wait until the end of the year to plan for the next year. Maybe you should make a year-round commitment, renewing it every day. I've learned that works best for me. But still, I don't always succeed. You probably remember that a number of months ago, I planned to lose some weight. I did, but it came back quickly. So anyway, I decided to do some research, seeking the kinds of New Year's resolutions that one can make that has some promise of success. And I turned to my old reliable friend, the CDC, the Centers for Disease Control and Prevention, to get some ideas. And as I suggested at the outset, let's keep this personal, just between you and me. I will have no guest in the studio today. I'm just going to informally share some great information that I think you will find both noteworthy and helpful. These are simple things, easily done with great benefits. When most people think of the holidays, the song "The 12 Days of Christmas" frequently comes to mind. You know, 2 turtle doves, 3 French hens, a partridge in a pear tree, and the like. Well, last year, the CDC recommended the 12 ways to have a happy holiday season, as well as year-round. Again, these are simple, easily manageable things that offer considerable rewards. Here you go. Number 1, wash hands often to prevent the spread of germs. Remember, it's flu season. Wash your hands with soap and clean water, clean running water, for at least 20 seconds. Number 2, manage stress. If you feel stressed out, overwhelmed, and out of control, give yourself a break. Find support, connect socially, and get plenty of sleep. Number 3, don't drink and drive or let others drink and drive. If you're going to party hardy, get a designated driver. Number 4, bundle up to stay dry and warm. Wear appropriate outdoor clothing, light, warm layers, gloves, hats, scarves, and waterproof boots. Number 5, be smoke-free. Avoid smoking and secondhand smoke. Smokers have greater health risks because of their tobacco use, but non-smokers also are at great risk when exposed to tobacco smoke. Number 6, fasten seat belts while driving or riding in a motor vehicle. Always buckle your children in the car using a child safety seat, booster seat, or seat belt according to their height, weight, and age. Buckle up every time, no matter how short the trip, and encourage passengers to do the same. Number 7, get health exams and screenings. Ask your health care provider what exams you need and when you should get them. Update your personal and family history. Number 8, get your vaccinations. Vaccinations help prevent disease and save lives. Everyone over 6 months and older should get a flu vaccine each year. Number 9, monitor children. Keep potentially dangerous toys, food, drinks, and household items and other objects out of children's reach. Protect them from drowning, burns, falls, and other potential accidents. Number 10, practice fire safety. Most residential fires occur during the winter months, so don't leave fireplaces, space heaters, food cooking on stoves, or candles unattended. Have an emergency plan and practice it regularly. Number 11, prepare food safely. Wash hands and surfaces often. Avoid cross-contamination. Cook foods to proper temperatures and refrigerate foods properly. And number 12, eat healthy and stay active. Eat fruits and vegetables. Limit your portion sizes and foods high in fat, salt, and sugar. Also be active for at least 2.5 hours a week, and help kids and teens be active for at least 1 hour a day. So that's it. 12 simple resolutions can be easily done, and that you can put into practice year-round, keeping you and yours healthy and happy. Essentially, the CDC's 12 ways to have a happy holiday season are about routine things that you can do to maintain good health. But what about in an emergency? Are you prepared in the event of a natural or man-made disaster? It might not be a bad idea at all at the end of 2015 to resolve to be prepared in 2016. It too can be fairly easily done. A few years ago, the CDC suggested that Americans begin the new year with a novel plan of 31 days of preparedness. If you find it difficult to adhere to your New Year's resolutions throughout the year, perhaps a concentrated effort over the short term, say the month of January, might be a great way to keep a resolution that will also help you and your family be prepared for any emergency. We're going to take a short break now, but when I return, I have some great more suggestions on easily achieved New Year's resolutions. But first, let's take a look at a great workout segment by Tasha Turnbull of T2 Fitness. I'll see you on the other side of the break.
Hi, this is Tasha Turnbull with T2 Fitness and your T2 and 60. We're going to do 2 exercises today to get your heart rate up, and then we're also going to move into a compound exercise that's going to work the total body. So I have some weights. If you don't have weights, you don't have to use them. If you want to add them in, let's go. So we're just going to lunge from side to side, wide lunges. So you should get your heart rate, you should feel it going up. You should also feel your legs going and you using the butt, the gluteus maximus, so you should feel that. So the faster you go, the more your heart rate goes up. From here, we're going to go into front kicks, bringing the arms up at the same time. So this is working our arms, our legs, our core, and getting our heart rate up. So remember, lunges, kicks. Got it? See you next time.
So, has Tasha got you fired up to hear more great suggestions for your 2016 New Year's resolutions? Let's take a look now at the CDC's 31 Days of Emergency Preparedness Plan. Day 1, make an emergency kit for your second home, your car. Items already found in your house can make a great emergency kit for your car. Things like a blanket, flashlight, batteries, first aid kit, granola bars. Store your items in a bag in the trunk so that they are secure and out of the way until needed. Complete your kit with road flares and jumper cables. Day 2, always keep your gas tank at least half full. If you're ever stranded or have to evacuate, you'll be glad that you did. Day 3, learn how to change a tire. Everyone should know how to change a tire. Even if you've got roadside assistance, there may be times when that isn't an option. Review your owner's manual and try a test run at your house when there's no pressure. Day 4, establish and/or review an evacuation plan from your house. Sit down with your family and go over each exit route in the house and how you would get out if there were a fire or other emergency. Sketch a floor plan of your home. Walk through each room and discuss evacuation details with your family. Day 5, put together a first aid kit for your home. Here are some items that you should include in everyone's first aid kit. If you or your family member have a special need, make sure to consider these when putting your kit together. Bandages, alcohol swabs, tweezers, thermometer, instant cold compress, gauze pads, aspirin, first aid instruction booklet, blanket, non-latex gloves. Day 6, stock up on water. If your pipes burst or freeze or flood water contaminates the treatment plant, you need to have supplies on hand. Make sure you store a gallon of water for 3 days for each member of your family, including your pet. Day 7, stock up on food. Floods, snow, severe storms, and any number of other natural disasters can limit your access to the grocery store. Make sure you always have additional food in your house, non-perishable foods that can last each person in the house for 3 days. Keep a manual can opener in hand, but avoid canned goods that are dented or swollen. Day 8, copy important papers. Keep copies of all important papers, birth certificates, passports, deeds, etc., in a fireproof box in a designated area in the house. Make an electronic copy and email it to yourself. Day 9, write down important phone numbers, including the fire and police departments, poison control, and the family practitioner. Give to a trusted neighbor, an out-of-town friend or relative. Put a copy of this list in your emergency kit and post another copy on your fridge. Program them into your cell phone. Day 10, make a list of your prescriptions. Write down a list of all the medicines you take, the dosage, and any allergies. Keep this list with other important documents. Day 11, check your flashlight and radios. Double check all electronics in your emergency kit. Replace any batteries or devices that have passed their prime. Day 12, Check your smoke detectors. This should be done every month. All you have to do is press the test button on your detector and check that the device beeps or sounds loudly. Replace smoke detector batteries at least once a year. Do this on a date that's special to you, like your birthday or a holiday when you know you'll be at home. Day 13. Identify a meeting place outside of your home. Certain emergencies like fires require that you evacuate your house. Make sure you and your family have a safe place to meet outside of your home, like a neighbor's driveway. Be sure everyone is clear on where they should go and do a test run. Day 14. Find out what emergencies are likely where you live. Take time to learn what disasters are likely in your area and make sure you know how you should respond. Day 15. Identify an area in your home to shelter in place. During an earthquake, tornado, or severe storm, you will need to shelter in place. Find a secure area in your home where you and your family can go. Choose a room in advance for your shelter. The best room is one with as few windows and doors as possible, like a basement. A big room, preferably with a water source, is always a good choice, such as a bedroom that is attached to a bathroom. Day 16. Test your emergency plan with your family. Review where everyone should go if they need to shelter in place. Leave the house or evacuate the town. Go over where important documents and phone numbers are located and designate a family member each person should call to check in. Day 17. Stock up on batteries. You should always have an extra supply of batteries for your flashlights and radio and other gadgets. Make a list of the different kinds of batteries that your devices require and stock up on the next time you go to the grocery store. Day 18. Create an emergency kit for your work. Since you spend most of your day at your workplace, it makes sense to also have an emergency kit there too. Include food and water along with first aid supplies, a copy of your medicines, and a list of phone numbers. Day 19. Review your workplace evacuation plan. Every office should have an evacuation plan in case of fire or other emergency. Make sure you know where all the exits are and where you and your coworkers are supposed to meet outside. Day 20. Notify coworkers of medical conditions. Do you have asthma, diabetes, or are you allergic to shellfish or certain medicines? These are all things your coworkers should know in case of an emergency. Keep a list of any allergies or other conditions posted in your office or cubicle. Day 21. Learn what the different weather warnings mean. Do you know the difference between a hurricane or tornado warning versus a hurricane or tornado watch? Learn what the differences are. Day 22. Review tips on what to do after an emergency. Knowing what to do after a disaster is just as important as being prepared before it happens. There are certain things you should know following a flood, hurricane, or tornado or other disaster. Day 23. Learn how to safely use a generator. If you have a generator, make sure you know how to use it properly. Follow the manufacturer's directions for installation and operation. And to prevent electrical shock, make sure your generator is properly grounded. The operation manual should provide correct grounding procedures. Use electric generators or other fuel-powered machines outside where deadly carbon monoxide fumes cannot enter the house. Use a generator only in a well-ventilated and dry area located from air intakes into the house. Do not use a generator in an attached garage. Day 24. Know the locations of your local Red Cross shelters. These shelters help those displaced by providing meals and snacks to families and to emergency workers in affected areas. Red Cross nurses provide first aid and look after other health-related matters. Day 25. Don't forget about your pets. Do you have food and water for your pets included in your emergency kit? Do you know what you would do if they couldn't come with you to an evacuation shelter? Make sure your emergency plan and kit includes your pets, such as food and water for at least 3 days for each pet, food and water bowls, and a manual can opener. Depending on the pet, litter and litter box or newspapers, paper towels, plastic trash bags, grooming items, and household bleach, medications and medical records, first aid kit, and a pet first aid book. Sturdy leashes to transport pets safely and to ensure that your pets cannot escape. A pet carrier, pet toys, and the pet's bed, if you can easily take it to decrease stress. Day 26. Make a bug-out bag. A bug-out bag is a small emergency kit that you can grab whenever you need to get out fast. Include food and water, first aid, and a copy of important phone numbers, prescriptions, and documents. It's also good to include a change of clothes and some spare cash. You can store this in your house or car if you're on the go a lot. Day 27. Learn CPR. CPR saves lives. The earlier CPR is started, the better the chances of survival. Day 28. As we said earlier, wash hands often. Proper hand washing can prevent foodborne illnesses, the spread of disease, and outbreaks. If clean running water is not accessible during emergencies, use soap and available water. Day 29. Keep sanitation supplies in your emergency kit. When soap and water are unavailable, use an alcohol-based hand sanitizer that contains at least 60% alcohol to clean your hands. Keep things like Purell, alcohol swabs, and hydrogen peroxide in your emergency kit. Day 30. Keep sleeping bags near your emergency kit at home. Keep sleeping bags and blankets readily available in case you have to take shelter for an extended period or if evacuation is necessary. Day 31, celebrate. If you followed each of the CDC's tips for the 31 days in January 2016, you will have made and kept an important New Year's resolution and will be ready before and after a disaster. Now, I don't know about you, but I'm looking forward to 2016 with great hope and expectation. I hope you are too. I hope that you found all of these tips helpful. I'll see you in 2016. Thank you for joining us for today's edition of Health Watch. Remember, you can catch us online at www.norfolk.gov/healthwatch. If you'd like to drop me a line, you can email me at terrence.affer-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Affer Anderson, and this has been Health Watch.